What's up, everybody? It is your good friend Raf Esparza here on a beautiful Thursday afternoon. It's 1:42 over here, Best Coast time. We have an excellent guest. We'll get to him in just a second, but I just want to remind you guys, if you can do something so nice as writing down the names of 3 small businesses or individuals and see what you can do to help. If you can financially buy a product or maybe some privates from them, that's cool. But I would suggest, all these people need a lot of organizational help as well. You can volunteer your time, you can volunteer your efforts, and at the very least, check in on your teammates. So that's kind of the push that we're doing here with our #Save Jiu-Jitsu Gym series. Today, I think we have a very practical, important, and necessary sort of discussion, which is how do we open back up? If you guys had the opportunity to listen to my guest today on Stephen Kesting's podcast, you likely came away with a lot of information, maybe some questions, perhaps a little uncertainty. It's my hope today that we are able to quell some of that and also get us on the track for at least figuring out how it is that we come back. Our guest today is known in the jiu-jitsu circles as a fierce competitor, but who knew that behind the scenes, he's also a guy who's also trying to figure out how to save us. So if there's anybody who wants to get back on the mats, I believe you find a likely ally in one, Dr. Chris Moriarty. Chris, how are you doing, sir?
Great. Thanks for having me on.
Not a problem, sir. Apologies. I mean, you are a very busy man. We very much appreciate you being able to come through with us today.
No problem. Sorry, I missed your first attempt. I had some patient results. I'm not even in clinic this afternoon, but I was here studying and working on some things, and I got some results from some imaging that we did on a patient that came across my desk. And I tried to source some things out and do, contact the person, but then there was the whole IT problem, and I couldn't prescribe anything, and it ended up taking something I thought was going to take 10 minutes took me 3 hours. So I apologize.
Well, I think we just lost your audio for a split second, so I want to make sure okay. We repeat that. Do you mind repeating that? Do you still hear me fine, right?
I hear you fine. Can you hear me?
Yeah, I don't hear you right now, which is now a problem. I'm going to go ahead and double check on the broadcast that you are being heard, because if not, then I'm just the idiot, and we can go from there.
Let's see if I flip this.
Yep, they hear me. So let me go ahead and see if you can go in. You're on your phone, right?
Yeah. Can you hear me?
Do you mind? Oh, I think that's what you're saying. Yeah, I think if you press it and double check, it might have actually just reframed. I don't know if you have ear headphones that you normally have, but there's usually either on your phone or your headphones are the two places.
No, the audio should work. You can't hear me? Hello?
Okay. Okay, on the broadcast, you're coming through just fine. Give me 1 second. Let me see if I can fix this on one side over here. I have a secondary option, which is to hear you through the backup. Thanks, you guys, for being so patient with us. All right. Chris, can you hear me okay again?
Yeah.
Okay, great. Well, everybody, so we have to do a certain test to make sure that Dr. Moriarty is one that we can trust in these matters. So I think for those of you who are watching, I know there's some important questions to ask. Do you mind answering these real quick?
Sure.
First, are you or are you not a part of the Illuminati?
I don't think so. But then again, I mean, somebody, you might be and not even know it, I guess.
Number 2, is Bill Gates paying you to say anything today?
That one's awesome. Again, not that I know of, but is he secretly funding something that I've benefited from somehow, like my fellowship stipend for conferences? I mean, is he behind that? He could be.
Likely story. Okay. Have you made any blood sacrifices today?
No. That one I can say is a no.
Are you willing to make one?
To who?
Hmm.
Right? You know what I mean?
Interesting. Fair enough. All right, let's get to the real science of this whole thing. So one of the things that I think is important that understand is a little bit about your background. So, tell us a little bit about you, what you've been working on, and how you ended up pivoting some of that to specifically the COVID situation.
Okay, well, talked a little bit about this on Seven's broadcast. So basically, I've been doing jiu-jitsu since I was 18 years old. I'm 36. I got my black belt in December 2008 from Homero Cavalcanti Jacare, the head instructor, the master of Alliance team. And I started medical school in 2010, graduated in 2014, did my internship in New York, my 3-year residency in physical medicine rehabilitation in Miami, Florida, the University of Miami. And then I'm doing a 1-year primary care sports medicine fellowship in Dayton, Ohio, affiliated with Soin Medical Center, previously Wright State. And so, one of my passions in sports medicine is to try to create a niche for grappling, for combat sports, but mostly focusing on grappling, Brazilian jiu-jitsu, no-gi grappling, and making people more familiar with our sport and the unique injury patterns that present, and just making physicians more able to help us. How many times have people gone into a physician and you try to explain to them what you do, how you got injured? They have no idea what you're talking about. They don't understand. They think you do Taekwondo. So I think getting the information out there is important. So I, published the so far the largest epidemiological study of Brazilian Jiu-Jitsu injuries in September 2019. And before all this started, I was working on a systematic review and meta-analysis of Brazilian Jiu-Jitsu injuries with 2 other guys. But then, this happened and everything kind of stopped. So really what happened with me that got me involved was I was supposed to give a lecture to the athletic trainers associated with our hospital network. Because, we have contracts with a lot of local high schools and a few colleges. And so the athletic trainers go out and, take care of those teams. And so we cover a lot of the games too. And a couple of times a year, we'll give lectures. And I was supposed to give a lecture on pediatric low back pain or something. But then I started seeing all the information that was coming out about COVID. I was getting, I have so many things that get sent to me through email from all these different medical societies that somehow got my email. And I used to have a subscription to New England Journal of Medicine, and so I still get stuff from them. And they sent me something about the first COVID-19 case in the U.S., the first one that was diagnosed. And I read through it, and it scared me. It was shocking. And then I started looking at the cases that were in Washington State at the time, and how quickly it was spreading, and how long it can go undiagnosed, how long somebody can be pre-symptomatic or in an incubation period and spread it. And so when I saw that happening, I knew that this was going to go everywhere. I knew it was going to spread. I knew that we were going to be way behind, that we weren't going to be able to contain it. And so I wanted to talk to all the athletic trainers about it. So like maybe 5 days before I was scheduled to give my talk, I changed everything and I just made it all about COVID. And at first, people were saying, okay, well, you can do that, but you should still talk a little bit about pediatric low back pain. And I kind of was like, okay, but then at the last minute I didn't, because I knew that this was going to be a big deal. Because we had some wrestling tournaments coming up and stuff. So that was kind of like really what started it for me. And then after that, I had that, big concentration of learning about this topic. Because, if you've ever had to present a topic or give a lecture, you always learn the most about anything when you're expecting that somebody's going to push back on you or ask you questions, because you want to make sure that you kind of you have all your ducks in a row before you go give that topic, as opposed to just reading something. So that was really the thing that got me involved. And then I started seeing, academies, people kind of coming out saying, oh, this is no big deal. I'm not closing my academy. This isn't going to affect anyone. If you're old, stay home. And it just became clear to me that people weren't seeing this for what it was. And and that we had to, we had to do something.
And I appreciate you doing that, because in this climate, it is very easy to, when people get pushback, say like, you know what, I don't even care. You know what, you guys, you're on your own, kind of a thing. But we have a very aggressive community that I think at its base is scared and doesn't like it. And that's their form of reacting. And I think that's part of the fear that has inhibited so many of the conspiracy theories and, all these simple answers. That's like, oh, Bill Gates is behind it. Scooby-Doo ending. Figured it out.
Yeah.
And so for me, I have a high appreciation for somebody because, my expertise isn't medicine. It's not this. So to get somebody who can say, all right, I understand it's going to take a little bit to get back. Here are my suggestions that are, at the very least, understanding of the real threat and keeping our students safe.
Yeah, again, there's different levels of expertise in any topic, right? How it is if you're talking, if it's you talking to a lay person or a lay group of people about jiu-jitsu, then in that case, any black belt is going to be an expert. But if it's, you're talking to a bunch of black belts about one thing, then there's going to be different levels of expertise. Obviously, I am not a virologist. I'm not an epidemiologist. I don't have a master's of public health. But, it's, part of my background in medicine and especially like during my first 2 years of postgraduate medical training, my internship year and my first year of residency in PM&R, I took care of a lot of people that were sick and had respiratory illnesses. And, and then throughout medical school, you do so much studying of those, virology and microbiology and immunology. And, also, looking at biostatistics and evaluating studies. And then I've done quite a bit of research on my own. So I know how difficult it is to, the epidemiological study I did took me 2 years to publish, just because, there's a bunch of things going on at the same time. But, when you have 1,600 submissions to a survey, you got to go through every single one and make sure that they're logical. And then you got to run statistical analysis. And are you answering the right question? So I know that things are very complicated, and I want people to appreciate that part. And I also wanted people in the community to know that somebody that deeply cares about the community, that wouldn't be a physician if it weren't for jiu-jitsu, is putting this out there. I don't get anything out of gyms being closed. It doesn't make me happy. I mistrain just as much as anybody else. It's just, unfortunately, this is just where we are. And I just hope that, I hope that maybe some of the people that didn't take this as seriously would look at me a little bit differently or with a little bit more credibility than just some, pencil neck scientist in DC,
I guess I've seen you compete, so I don't think you're just some nerd that doesn't have an appreciation or doesn't want to get back themselves. So I think that point is well taken. Before we get into the actual plan, I'm trying to address those people who want to just go and open their gym up, and they feel threatened. They feel like their liberties are taken away. And my thing is, okay, there are some definite discussions. We definitely want to keep your academies open. But a lot of people seem to be going off of the argumentation, which is there's always a risk associated with jiu-jitsu. So who cares?
Yeah. I guess I don't know what in that case, like what you mean by risk. I mean, there's certain risks that there's certain risks that are very well understood and very predictable. Like if you do jiu-jitsu, there's always a risk that you'll dislocate your elbow, right? Those are things that are predictable, and you can show people how they can avoid, having that happen to them. There's things, and those are risks that that apply to individuals, single people, not communities. They're not transmissible. They're not contagious. those are things that, it's, that's, I don't really know, I don't know if people that are making that argument really, if, I don't know. I want to give people credibility. I don't want to say that people are being disingenuous, but I wonder if they really even believe that argument, like this is the same as that. Because it's just very clearly not. This is totally unprecedented. I mean, we haven't had anything like this in 100 years. You've never met anybody that's gone through this. So look, I really do understand why people want to open their gyms. I really do. And the thing is, the way that the argument, the other reason I wanted to put these out is because I didn't want the argument to be framed as all or nothing, right? So people waited around, and they said, you know what, screw this, I'm opening. Yeah. And it's like, it never had to be that way. There are ways to open in phases. I mean, no country's just opening up the entire economy in one fell swoop, right? We're doing it in phases because that's the only way that you can see. That's the only way you can see, you can determine where you can backtrack to. So if you're seeing that over a period of time, you're having declining numbers of new daily cases or declining percentage of tests that are coming back positive, then you say, okay, at this time, we're improving. We're getting fewer people sick. We're winning. All right, let's see what happens when we open up this, and this. And then you follow it for a little bit. Okay, we're still winning. Okay, let's see what happens when we open up now this, and this. Oh, we're losing a little bit. All right, let's say maybe we don't close down all three of the things we just opened. We close down where were the clusters of cases? Where were the most things associated with it? We're going to back that one off a little bit. But when you go from 0 to 100, you can't tell. You have no reference for what things worked and what things didn't. I mean, we don't approach anything in life this way. So, I mean, in a way where you just go from nothing to everything, right? So I just would say, well, why wouldn't you try to open it in phases? That would be my only pushback. I understand you want to open. Why not try opening in the safest way possible?
I would say, and you're transitioning nicely into your phases that you've mapped out. But I would say this, I'm making a big case to people to say, listen, be very supportive of your gyms, understand this is going to be an evolving thing. Once they open, you're still going to have to be there for them and the economic impact that they've taken. However, I preface that with, I think gym owners have to be equally responsible and respect that due diligence that they're being afforded. So that means if you can take these steps, and you should, do them, because at the very least, it's in recognition of something that could very well affect your students. And I don't sincerely believe that one person would feel callous if anything happened to their students. So I like what you proposed. Let's go ahead and show some of these steps. I want to go ahead and make sure that people can see them. So I'm putting them up over here. Let's just go ahead and kind of talk through it. Obviously there's a lot of density here, but I'd love to hear it. So preface, you want to make sure when people are understanding, okay, we're going to actually make a plan. We're going to actually engage something. Kind of walk us through the kind of conditions that you set before even getting to the phase.
So if you look at Trump's reopening guidelines, and I just got something today that Trump now is like backtracking on these guidelines, but to me that's irrelevant because if he's backtracking, actually I shouldn't say it's irrelevant because I haven't gotten to look at everything that he wrote, but the guidelines were written in a very careful way, a very logical way, after enough data was obtained to be able to say, okay, we have an idea of how the epidemiological curve of this virus is going to look, how this virus operates from a public health perspective. So I think they waited and they put out good information. And so the one criterion that I use from them is the requirement for a trend of declining daily new cases. Or if you have increased testing capacity in your area, you may have increasing numbers of new cases, but you have a decrease in the number of tests that come back positive. So both of those tell you the same thing, that one of them tells you that you're testing the same amount of people, but you have lower numbers of new cases. The other one is you're testing more people, but you're having fewer people come back as positive. Those are both wins. That means that in the current environment, you are not creating a hospitable environment for the virus to transmit itself. So you're eventually, if you follow that indefinitely, you would theoretically get down to zero, right? Now, of course, that doesn't take into account that interstate commerce and people ignoring guidelines and, places opening back up early and stuff. But those are the basic criteria. And so that criterion is identical for entering phases 1, 2, and 3. So phase 1 is just preparing your academy. So if you're in an area that you've already met criteria for the Trump phase 1 guidelines, that only takes you as long as it takes you to prepare that infrastructure for you to open up for phase 2. I'm not saying that it should take 14 days. It would be a safe way to do it, right? You're going to say, all right, let's keep an eye on this for 14 days and make sure things are still going in the right direction. And then you move on to phase 2. But if you have everything that you need already set up, then you can move on to phase 2. Phase 2 is purely instructor-led solo drills. And so
hold on real quick. I just want to make sure. I know there's a part about antibody that you just briefly mentioned in the preface as well. I can go to those slides in a second, but I just kind of want to bring up why antibodies aren't just a free pass.
Yeah. So again, this is, everything is changing really quickly. So, tomorrow I'm going to go through everything in the FDA and CDC that I can find and see, what's changed. But antibody tests right now have not been demonstrated, or you never say the word proven, but have not demonstrated good enough reliability as a group to say that if you've got, this random antibody test that came back positive, that you should consider yourself protected against subsequent infection, right? I don't know what the numbers are now, but if you go to the FDA website and you look up emergency use authorization, the FDA is giving this special privilege to certain tests to be used for study purposes, or to look for people that could be donors of plasma. So people that were known to have been infected, had positive RT-PCR, had symptoms, recovered, and then they have positive antibodies. Some of those people were, initially, I don't know what the studies are still doing, but you were looking at taking plasma from those people, so some antibodies that were in their blood, and then using that as a therapy for some of the sicker patients. So they're using it to detect those people. They're also using it for kind of to see how many antibodies are out in the general public, to get an idea of how many people have been exposed but weren't sick. But I don't think there's just no reason to believe, and I think it would be dangerous right now to think that going to whatever clinic next door that's selling some antibody test that hasn't specifically been given emergency use authorization, and saying, okay, I'm going to get a test, even though you've had no reason to believe that you've been exposed, and it comes back positive. And then you don't want to go out and think that you can just expose yourself and that you'll be okay, because there's no reason to believe that. So I purposely left that out of my protocol, except I've left antibody testing on my protocol, except as it applies to people that, like I said, were known to have had COVID via RT-PCR, the test that looks for viral particles, the test that diagnoses you, and had symptoms and recovered, and they were found to have antibodies with I would say an authorized test, not an approved test, an authorized test. Those people represent to me a unique group of people, but otherwise antibody tests are not useful yet.
Okay. That's a very good outline. Thank you for very much helping us understand that. Phase 1 is just the preparation, right?
Yes.
Okay. So let's kind of run through some of these. A lot of this is going to be the determining solo drills. It's making sure how many staff members are going to be there, hand sanitization. Like, these are very practical considerations. And this is in response to the Trump 3-phase outline that was originally proposed, right?
Yes, the three, like I said, the criterion for the first 3 phases is the same criterion in terms of looking at new cases that the Trump guidelines use. They also have different criteria for PPE in hospital settings and something related to hospital capacity and testing capacity, because they're responsible for a huge group of people. And, you don't want to loosen restrictions in an area that you don't know yet has the personal protective equipment capacity necessary for the provider. So I've left those out of these. I'm really just looking at the new cases, which is the main criterion, but they're identical. The first three phases are identical to the Trump guidelines.
Okay. And this is good because it does identify, okay, grappling dummies might actually be a possibility. And there's definitely going to be people who don't want any part of that. So maybe you can come in on a different phase.
Yeah. And I mean, some pushback I've gotten from people is, that, like the people that are complaining about this, are brown and black belts, and me some purple belts. It's like, man, this is stupid. It's a waste of time. And I was like, listen, so if you're a brown or black belt, yeah, I mean, or you want to go in several days a week for instructor-led solo drills when you're an instructor sometimes and you lead these solo drills? No, it might not be that useful to you. And this isn't directed towards you, but, I don't know what percentage of an academy the brown and black belts typically make. I wouldn't imagine that it would be more than, 20%. But I could be wrong. I have no idea. I don't run an academy, but, the people that you're really trying to retain are your new white belts, the blue belts, the people that have been doing jiu-jitsu for a year, the people, or 2 years, the people that are most likely to quit, the people that are most likely to get frustrated and quit, are the people that are most likely to just kind of move on with their lives and forget because they haven't been in jiu-jitsu for a while. And those are the people that you want to get back on the mat as soon as possible and get interacting again with the instructor staff and, to a limited extent with each other. So, one other thing that I didn't previously mention that, when people that have been poo-pooing solo drills a lot is that, so this is going to be kind of a tangent, but people have been poo-pooing the value of that kind of thing. I don't really enjoy teaching private lessons. I don't know how many people feel like that. I like teaching private lessons if somebody is advanced enough to need specific guidance in a specific situation, and they see something that I do and they want to learn something from me. And then those are really fun lessons, right? Because I have unique expertise that I can give to you. And I feel like that you're paying me for something that is valuable, and I don't have a problem, charging what I think my time is worth. Mm-hmm. But if you're a white belt or a blue belt and you don't know how to lock a triangle or something like that, I feel like, do I really want to teach that private for, $200 an hour, or $150 an hour? I mean, I don't enjoy that. I don't feel good about it. I don't enjoy the process. I think that a lot of times that those privates could be given to somebody that's a really good purple belt or a brown belt, and they could get just as much out of it. And so what I started realizing, though, is, what I started seeing was that when I would end up with those privates, sometimes people would really want to do them. I would get to a move and I'd want to show them a technique, but I'd realize that they couldn't even move their bodies in the way necessary to do the technique. They didn't understand what I meant by like swiveling your hips, or they didn't know how to do a reverse shrimp, or if they didn't know how to do a shrimp without having their back on the floor, their hips on the floor, they couldn't keep their hips off the floor. And so what I had maybe 2 different people teaching private lessons to, and I was just like, we're starting all the way over at the beginning, and I basically worked through them each fundamental movement one at a time and started adding them to the warm-up at the beginning of the lesson. And so the warm-ups, got longer and longer and longer in terms of the number of techniques they would do, but they actually over time got shorter and shorter in the amount of time it would take them to do them, because while they're doing them, I'm giving them constant feedback. No, why are you rolling this way? What are you trying to do in this position? Stop. Where do your hands need to be? And so after maybe 2 months, you have a guy that can't see that his hips are moving the exact same way in these 3 different arm bar techniques. But now that you've shown him how to do that hip movement, now he sees it every time and you don't have to reteach it. Mm-hmm. So I found that I have like a thing I created for myself, and it's basically like a list of all these fundamental movements that you have to do on your own. And then I created like a flow sheet, like a flow from like how, you know, if you're doing this shrimp, how you can move, you can kind of combine these together in one smooth drill. And I basically say, if you can't do all of those things to my satisfaction, you're not at a point where I can teach you moves on a partner. And so it's interesting to me now that it's just kind of coincidence that this came up, because I actually drew that up probably in January. And so I feel like that there's so much benefit that people can get out of that, white and blue belts. And even though people are doing them in Zoom classes, it's very different when you're in the same room with someone and they can see your whole body and you can give direct feedback. So I really think that it is valuable to do this in stages, to get, you know, white and blue belts. And every now and then, you know, you're going to get the events guys to come back in, because you know what, you know, as well as I do, that there's some guys that have gotten all the way through to brown and black belt that have never learned like one or two fundamental things. They just never learned it, you know, so this can benefit everyone.
I say I'm a purple belt, and there's some stuff I skip, you know, and I don't ever look down upon revisiting those things. But let's push forward to
the beautiful thing about jiu-jitsu is that it all catches up with you. Anything that you decided to not learn or hide away from, it's going to come up. Trust me.
Absolutely, sir. All right. This is phase 2, and this is the most, I think, intensive of the phases. Am I correct in this?
Intensive.
Well, there's a lot of detail to it. So walking through it, this is with the premise that testing is available and that we see a trajectory, correct?
Right. So this doesn't, like, the thing that people ask is like, okay, well, but you know, you can be asymptomatic and pass this on and da 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 da, and like, no, it's true. That's why you can't just jump into phase 2. Like, you couldn't say, like, if you're an academy in like an area like right now, like Illinois, where cases are, I think it's Illinois, but there's certain places where cases are still going up, or if they're starting to flatten, they're just beginning to flatten. You're not ready to even start to think about going into phase 2 yet. You need to be on your local Department of Health's website. You need to be yourself tracking new daily cases. You need to be tracking the number of the percentage of positives that are coming back from the RT-PCR. You need to be tracking these things, and you need to be, I think you should be keeping your members aware. Okay, look, you know, we've had 5 days in a row of, you know, decreasing number of cases. Let's, you know, hope, you know, tomorrow we get another one. And then at the end of 14 days, if you've done it, be like, we did it. You know, we're at the spot. We're going to start getting the academy ready. You know, we'll let you guys know when we're ready. So I think that, yeah, of course, if you were in a place where case counts or, you know, numbers of new cases were still going up, you still had an upward trajectory to your epidemiological curve, yeah, I wouldn't propose any of these things. I wouldn't propose having, you know, people together inside of a room doing these things. But you're talking about having at least 14 days of declining new cases, but is more than that, because as long as it takes you to prep your academy, so probably a week or so, let's say, maybe up to 2 weeks, I don't know, but you know, you're going to have, so, you know, 21 to 28 days before you're even entering phase 2. And so at that point, you're also looking, when somebody comes in, steps into the academy, they've had no known contacts. They've had nobody that they've known that's tested positive for COVID in the last 14 days. They don't work in any occupation that exposes them to COVID in any significantly more than any other occupation. They're totally asymptomatic, and they don't have a fever, and they haven't been to an area that has an you know, increasing numbers of cases. So you're doing a lot of historical and symptomatic screening in the setting of a place where you know that you've had, you know, 2 to 3 weeks, maybe 4 weeks of good control of the disease.
And a lot of this is going to really rely on that social, which is people being honest. And I think the question some people have had as well is, what does the temperature check really do?
I mean, we check temperatures every time you come into every time that you come into our clinic. We check temperatures. Anytime anybody goes in the hospital. I mean, Could you have a low grade fever and be asymptomatic? Sure, you can. Maybe you're just starting to have a fever. Maybe fever could be the only symptom that you have for a few days. You don't know. I mean, it's considering that fever, the presence of a fever, is almost ubiquitous in patients at some point that become symptomatic. It makes total sense to screen for fevers. I mean, why wouldn't you?
Yeah. And I totally understand this. The last one was just, making differentiation between folks who would be vulnerable to it, correct?
Right. So I forgot about that. So yeah, the other thing that you're checking is, do you have a unique susceptibility to having a really bad outcome or a very severe disease course if you were to become infected? Or do you live with someone or have consistent contact with someone in your household that has this risk? Those people aren't ready to come back yet. Because again, these guidelines do take into account some degree of personal choice and responsibility, right? Like, if you don't feel comfortable at any point, don't come back. If you're the owner that doesn't feel comfortable applying these guidelines, even in the setting of 14 days of decreasing cases and all that stuff, don't open. I'm not telling you to open. I'm not telling you what to do. There's a lot of things that people have brought up about phase one, about Stefan brought up some things about ventilation, and as a result of my conversation with him, we increased the distance, the minimum recommended distance. So people have brought up really good things, and these are not dictates, right? These are guidelines. So, people are saying, if you're sick, stay home, or if you're afraid, stay home, right? I'm in a way, I'm advocating that too, right? If you don't feel comfortable with these guidelines, don't come back. But I think that we do need to draw the line at people that have, unique susceptibilities to that. Those people shouldn't come back into phase two yet. I don't think they should come back during phase two.
I think that's a fair assessment. All right, we go over to phase three. Oh, all right. These are good outlines as well. Really limiting the amount of people who can be in the locker room and the bathroom at a time. Lots of available hand sanitizer and shoes. This is the stupid part that makes me angry. It's like, did it really take a pandemic for us to be like, maybe we should wear some shoes at all times?
Yeah, I mean, again, like, I didn't even attempt to go through all of the little things that people, would need to decide for their academies. Like, how far is your locker room away from your academy? Do you have a place to store all of your shoes around the mat? I mean, how big is your locker room? How wide is the hallway? I mean, like, what's the orientation of your mat? Is your mat against the wall? Is your mat in the center of the room? I mean, there's all these things that you, as like owners and instructors, have to think about on your own. So, I mean, some of these things are common sense, but some of them are going to require like a good bit of planning. Now, look, hands washing and disinfecting is not a solution to anything, right? It's just standard, right? I think the most important thing is, like, when you step into the academy, the first thing that you do is you do that, right? That's the first thing you do, right? You should have some hand sanitizer by the door, because we're screening and everything, but at the same time, we want to make sure that we're whatever you had in your house and your car and all that stuff, we're getting that off your hands the best that we can before you bring it into the academy.
And I appreciate you for identifying even the larger things, because it shows a true care of saying, okay, yeah, if you are screening, make sure you're having people a certain amount of distance as they come in. There's protocol for making sure that you don't just test, with a temperature check. You're going to have to sanitize that each time as well.
Yeah, I mean, you have to adjust. I mean, you probably should. Now, a temporal artery thermometer, you really don't have to touch the skin. But you're gonna be this far away from the skin, so you're gonna touch their skin. Sure. I mean, is it likely that you're going to become infected with COVID because the back of your ear touched the back of somebody else's ear? Probably not. You know what I mean? But I think that's the safest way to do it. I don't think an oral thermometer's really practical, just from a hygienic perspective, but also just like, you're gonna have to buy so many of the disposable sheets, and then you also have to make sure that, I mean, obviously you have to make sure you have batteries, but it just takes longer to do that test too, right? You've had taken your temperature and it takes 10, 15 seconds or whatever. So I just think temporal artery thermometer is just easier and it's cleaner. So there were some specific things I did bring up, but a lot of the things, I'd be happy if owners want to talk to me about them and, tell me what they, things, unique solutions they've come up with, but I can't possibly cover everything.
Right. And hey, it's appreciated for what you do. So, and I still think it's pretty extensive. I think at the very least, even if they don't want to do every single one of these, you've at least given them stuff to think about, which creates the dialogue of what keeps our students safe. And at that point, they can do what they want, Yeah,
exactly. I mean, really, this all really, I was sending this thing out to people and trying to get it on some bigger websites, kind of almost even anonymously, because I didn't want, there were some people that I had probably really irritated at the beginning of this because of my insistence about closing everything. And I didn't want people to see those, my name associated with them, and not want to share them. But, I'll come out and say it. When I saw the Tanner Rice thing, that was the thing that really, I was like, man, I have to make this public because, look, I know that, in his area, he doesn't have very many cases, and from where he's sitting, it just doesn't seem that dangerous. And, he's, had that issue with his landlord telling him that I think they're going to increase his rent. And, so I understand that he was in a bad situation, and but I didn't want people to see that and think, okay, well, yeah, it's all or nothing. You just open or you don't. And so actually, I tried to reach out to some people and say, hey, no, it's really not like that. Here are some options. But I wanted to make them public because I didn't want people to think that there were no other options. And I didn't want people to be able to tell other people that there weren't any. I wanted it to get out there wide so people knew that they were making a choice not to choose the safe route if they were just going with an all or nothing approach.
And Chris, I appreciate your diplomaticness about this, but I can summarize it very nicely for our followers and listeners. They can suck it, really, is what it comes down to. You either use these guidelines or don't. But for the most part, at the very least, you can't complain that nobody is out there trying to help you, your business, and your gym. And this is thorough. I was impressed by it. I liked it. I have to give credit to our good friend Alec Baldwin, who made sure to tell me to give him a shout out. Yeah, I screwed up his name. I heard it as I said it. But he doesn't deserve that much. He was like, hey, shout me out. And I was like, nah, I don't want to. But
the man, dude.
He's a great guy, a great instructor as well.
He's a savage.
All right, let's talk about this. Phase 3. This is where things get a little bit more hopeful because we're at the possibility of partner drills and sparring.
Right. So basically, it's really simple. If you're in an area where you don't have increased testing capacity, but basically what I'm talking about increased testing capacity is where basically your area says, hey, listen, if you just want to know that you have it today, if you want to know you have it for peace of mind, or, you need it to go back to work, to where it's really widely available, then that's a situation where you can say, okay, I'm not going to be able to do this every day. I would never recommend that people get a test every day. First of all, I don't think it's ever going to become available to a degree where anybody that ever wants you to test every single day or multiple times a day can get it, because it's a poor use of resources. It's very expensive. And the more, you can potentially, the more that you just randomly test someone over and over and over and over and over again, the more you can increase error rates or errors associated with a test. So, but I do think that in some places it's going to be possible to do this test for asymptomatic people with no specific exposures. People that are trying to get back to work. I know some states are implementing it. I think it's going to be possible to do it maybe once or twice a week.
I'm actually, after this, getting tested.
Yeah, that's awesome. Where are you? So you're in LA?
I'm in LA.
Yeah, so in LA County, I know that you can do that. You have to sign up online and they approve you or whatever, right?
Yeah, my wife works at a large mall, and so you keep seeing with California, they're starting to lean back things. So I just thought, all right, and she took the initiative, she did it, but I was like, hey, I want to make sure we know, and at the very least, we can make ideas or suggestions based off that.
So that's excellent. People were saying there's never going to be this kind of testing availability. And then, I think a few days later, I saw that
LA was starting to do it widespread and do widespread testing. And so this is great. You know, like
well, I also work at BC,
you know,
that's connected to Universal Studios. So I also want to know and be aware of what that means for that large of a company as well.
Right. You know, so I think that when you get to that point, first of all, remember to enter phase 3 now, you've had to have had 2 weeks of meeting the criteria to enter to phase 1. And then you probably have another week, at least a week, to prepare academy to enter phase 2, right? So that's, 35 days, right? Just to even enter phase 3, where you've had, and that's assuming that those 35 days have gone smoothly and that there have been no points where all of a sudden all the cases went up and you had to kind of restart the time clock. So you have at least 35 days of declining case counts, to where now you're looking at that the prevalence, the burden of the disease in that area is dropped significantly. And so, and then you also have this increased testing capacity. So anybody that tests positive, you're going to kind of know, you're going to have an idea of where those tests were. You had this many positive tests in this area, this many positive tests in this area. So you're going to have a lot more information that you're working with. And so I do feel at that point, now let me just say this, there isn't a single place, there isn't a single state in the US that meets these criteria. And I wouldn't expect there to be. But at that point, I would say that I'd feel comfortable. I don't necessarily have any problem saying that it's a reasonable thing to consider doing what you would basically do is you'd have somebody, you'd say, okay, on Tuesdays at 5 p.m., and then on Fridays at 5 p.m., we're going to have this test and we're going to have this class. And there can be no more than 10 people. You all have to sign up, and then you've got to bring in your negative test. And that test had to have been done immediately prior to class. So you're going to schedule your appointment to go get tested, let's say 4:30 p.m. or whatever place. You go and get tested. You come straight to the gym. You show your positive, your negative RT-PCR, and you still have to have met all of the other criteria, right? You haven't had any symptoms. You don't live with anybody that's had any symptoms or been positive. You don't work in a job that uniquely exposes you to COVID. You don't live with any vulnerable populations. People forgetting, so people become, I think, that have talked to me, been really focused on just the PCR part, but they're forgetting that it's 35 days to get there. And you still have to meet all the other criteria for everything else first. And these people are going to be alone in their own class, right? So, no, I think that is a reasonable way to do this. Now, people that aren't comfortable doing it, they can just stay doing the phase 2 stuff. Yep. Or if you're in an area that doesn't have the capability, you stay in phase 2.
Now we go to phase 4, which it starts to feel a little bit like normal. It's a 50% capacity back at academies, correct?
Yeah. I mean, so yeah, I would say, 50% capacity. Again, that's going to be on the instructors, but I would say no more than 50% of your capacity. Some people run classes where, if you've ever trained in Brazil, capacity in Brazil is a totally different. It's a totally different definition than here, because in Brazil, it's normal for you to be rolling into people constantly throughout the roll, right? They're fit so many people on a mat. Whereas in the US, if you roll into somebody during a roll, you move. So, I would say, like, for our standards, 50% would be where you're going to be pretty unlikely to bump into other people. It's not going to be where it's really packed. So that's just one safety measure. But the main thing there is that you're at a point where you effectively don't have any community transmission of the virus. Now, you might still have active cases in the hospital, right? Because an active case really just means that somebody in your community was diagnosed. But we know that people that get sick can be sick for 2, 3, 4 weeks before they recover. So that active case is going to be labeled as active until they've resolved, until there's been a resolution of the case. Either they've come back, they've cleared all their symptoms, they have negative RT-PCR, or they've passed away. So those cases, we don't focus on active cases. We focus on the number of new cases in your area per day. And once you've had a 14-day period where you aren't having any local cases, any new cases, that to me is the point at which, at least locally, you have the disease contained, and your chances of becoming exposed to it are not zero, but they're very, very, very low. And so I think that that's the only time where you can just say, okay, most people can come back to the academy and train normally, but you still don't allow those people that are at high risk come back in. I still think this was something we talked about. I started talking about 7-2. I still think that these screening protocols should be in place at the front of the academy, right? Because you want to make sure, have you been out of the area, right? You live in this area that's under control, but did you go to another area that's not under control? If you did, then you can't come in, right? So I still think you need to do that surveillance at the front and the temperature checks. But otherwise, in phase 4, you start to get back towards normalcy.
And phase 5 looks very familiar. This is feeling great, except for people like you. But we'll get to that at phase 6.
Yeah. So exactly, so phase 5. Now you've had essentially a month of no local person-to-person transmission. So I think at that point, almost anybody can come back to train, right? I think that you pretty much, you're demonstrated that it's the chance of you having acquired a case before coming to the academy is incredibly low. And at this point, any new local flares are going to be very easy to track, right? That's one thing that we're trying to do too. So people were talking about, okay, well, how long do you flatten the curve? And, we're going to have this forever. But what you want to do is you want to get the cases low enough so that you're not just looking at this big blur of cases that you can't tell where they came from. But if you get them to a certain point and all of a sudden in this area, you see this increase, you can actually go back and track all the contacts in a way that allows you to contain it. So I think even at that point, if you had 1 or 2 new cases, boom, you'd be able to get in there and control those. So I think at that point, you're in a really safe place to even allow people with maybe some immunocompromised to come back. But again, this is looking way down the line, right? Because this is now, you're talking about, 52, gosh, I can't do this math in my head right now. But you're talking about, 50 days or so of no new cases or something like that.
However, this is the one that I'm most excited to talk about for you because of the work that you're doing. This is the phase where you guys get to return back.
Well, let me say this. I don't want to people to take where I am. I am not somebody that's working. I have a friend that got recruited or pulled into doing ICU and emergency room care during COVID and the horrible, thankfully they're on the decline, but when they were on the upswing in one of the Manhattan hospitals, and he's a sports medicine fellow like me, and he had to go do that for 2 weeks. And so I don't, make no mistake, I'm not in that position. I'm in a very fortunate position where the, case, the caseload here is very low. And I don't see people that have known COVID. We screen everybody at the front. So I don't think I wouldn't say I'm not as safe as someone that has just been under, quarantine and stuff or, stayed at home, but I'm in a good spot. So I don't want to, I want to do, I don't think that the phase 6 guidelines necessarily apply to me. But I wouldn't have any problem staying out much longer than anybody else. I wouldn't come back during phase 2, for instance. I probably wouldn't even come back during phase 3, to be honest with you. But these are more for people that are taking care of active COVID patients.
Makes sense. Sorry about that delineation. I just wanted to make sure because I don't want to. I don't want to make sure that we don't cover our healthcare folks. So I thought that was a great phase to be putting back, especially within the context of jiu-jitsu. And ladies and gents, that takes us to, normalcy or whatever we can find at the point. But here's what I appreciate about what you did, Chris. And it's so hard to explain to people, which is we have so many people who are way more interested in getting involved in terrible debates that add nothing to the conversation. And there are a select few who are at the very least trying to get us to understand how we get back safely. And I feel like for that, I cannot tell you how much I appreciate what you were doing and what you were trying to inform with us. And I understand there's going to be pushback but I appreciate you for still doing it despite.
No, I feel like, it was just, jiu-jitsu, like I said, if it weren't for jiu-jitsu, I wouldn't be a doctor. So I owe jiu-jitsu a lot of what who I am and what I've been able to do in my life. I consider myself to be living my dream. A lot of people make fun, or a lot of jiu-jitsu people, it's not so bad anymore, but it was in vogue for a while to make fun of people that worked in offices or had regular jobs. And it's just like, man, there were a few years where I was doing jiu-jitsu and people thought it was the coolest thing in the world. And I was traveling around and competing. And all I wanted to do was just, what I was dreaming of was being behind a desk, like buried in a book, a medical book, And so, your dreams are your dreams. It's not any cooler to be wearing board shorts and live in an academy than it is being in an office, if being in an office is what you're passionate about. So for me, this was just a way to get back to jiu-jitsu, for allowing me to live my dream. And the last thing I wanted to say was that people talk about, so some owners will talk about, they'll say things like, oh, well, if you're afraid, if you don't want to come and train, you don't want to come and train, but I'm going to try, I'm going to open my gym. And it's like, okay, no, like whatever. I mean, we, that whole thing about that, it's not about you, it's about, people with comorbidities that, or, people that are immunocompromised that you could be affecting. The other thing that I don't think is brought out enough is, what about other academies in your area that don't feel comfortable yet? That they don't feel comfortable. The owners don't feel comfortable. Now, is it fair for you to be opening your academy and try? Are you in a way maybe pulling away students from that academy and hurting the jiu-jitsu business in your area? Because, you know what I mean? Like, I think one way to do it would be to, like, why don't all the academies in an area get together and talk? Be like, hey, listen, at least I don't mind, normal competition, but right now, if one of us opens up like a month before the other one because we don't care, or we're not as afraid, we don't believe in the science, right? Like, that is going to have that, fortunately, a lot of the students are not going to go, but you will have some people that are going to go. And, you got to think about, you could be hurting your other gyms too. You could be hurting your own local jiu-jitsu community.
Absolutely. And again, I appreciate it, dude. I see. Here's what I'm hoping. I'm hoping that we eventually get back, and that somewhere down the line, as my way of saying thanks, one day we get to train and I try to heel hook you as much as I can. That's going to involve phase 2 for me, which is you teaching me how to heel hook you. But I figure that's in the details.
Yeah, I'm not. I'm no leg lock wizard, but
no, you're really good. No, I'm not good at all. I feel like the effort, you're going to look at it and be like, we're back. Raf's back to doing terrible jiu-jitsu.
Yeah. Well, I look forward to you trying.
See, that's the right phrase. Chris, I have to say this. Thank you so much for outlining your steps. Again, we're going to have people trying to influence, even in our comment section right now, talking about what their feelings are on it. But I would implore you, if you are truly, truly passionate about this, maybe perhaps find a way to make your conversation a little bit more effective and a little bit more productive, if you're going to go ahead and contribute to the conversation, because all of us want our gyms to succeed. So please don't assume that that's a thing. But Chris, thank you so much for your time. Just want to remind you guys, we're doing a series all week. Later on tonight, I'm catching a beer with Vernon Kirk to talk about his gym and what he's been going through. In the meantime, I want to say thank you guys for checking in. #Save Jiu-Jitsu gyms, all that good stuff. We'll see you back on the mats eventually.